Research scientist James Thackeray is here talking about some of the cardiology highlights here at the meeting. Thank you for joining me.
Thank you for having me.
So let's talk about some of the groundbreaking research right now in cardiology.
So I think some of the major highlights of this year's meeting is a continuation of the trend which brings imaging targets closer to therapeutic targets. And the exciting area is being able to visualize precisely the markers that we're trying to treat so that you can get a more integrated theranostic look at how disease improves in response to new therapies and how we can visualize and monitor that over time.
I know that your specialty, of course, is the research, but how does what you're finding and using in the lab translate to, from bench to bedside?
So it's one of the real benefits of nuclear medicine is the compounds that we use preclinically are inherently translatable to clinical application. These are all the same compounds that can be used clinically. Our work immediately translates or in parallel translates to clinical work. And a lot of the findings that we have in looking at inflammation or fibroblast activation after cardiac injury get in parallel viewed in small animal models and large animal models and in patients. And there's a great deal of opportunity looking at theranostics and new treatments that build off of these same molecular imaging markers.
And this really has the potential to transform cardiology care. Let's face it, heart disease is one of the #1 killers.
Yeah, and I think it also moves us towards the ability to treat individual patients in the appropriate way for those individuals. That identifying patients with different molecular signatures to their disease, you can tailor the appropriate therapy a little bit more effectively.
And how will that transform cardiac care?
I think it builds a new bridge towards how nuclear medicine is integrated into patient care. That if we can move towards handling patients and not giving them all the same drug, that they're getting a drug that is perhaps very expensive or very focused and targeted, then we're at least treating the correct patient the correct way without unnecessarily treating with a false target application.
Moving toward more personalized medicine in your years of research, that must be very exciting for you.
It very much is. I'm very much looking forward to what this means for the future.
Okay. All right. Thank you for joining us.
Thank you.